Introduction. Arterial blood gases, ABGs, are a crucial diagnostic tool used to assess the acid-base balance, oxygenation, and ventilation status of patients. The analysis of ABGs provides valuable insights into the respiratory and metabolic status, aiding clinicians in diagnosing and managing a wide range of conditions. This detailed note aims to explain the parameters measured in ABGs, their normal ranges, and their clinical significance. Parameters measured in arterial blood gases. pH, acid-base balance. pH represents the hydrogen ion concentration in the blood and reflects the overall acid-base status. The normal arterial pH ranges from 7.35 to 7.45. Values below 7.35 indicate acidosis, while values above 7.45 indicate alkalosis. ABG analysis helps determine the underlying cause of these imbalances. Partial pressure of oxygen, PaO2, reflects the amount of oxygen dissolved in arterial blood. Normal PaO2 levels range between 75 and 100 mm of mercury. Lower values may indicate hypoxemia, while higher values may suggest hyperoxia. Partial pressure of carbon dioxide, PaCO2. PaCO2 represents the amount of carbon dioxide dissolved in arterial blood. The normal range for PaCO2 is 35 to 45 mm of mercury. Elevated levels indicate hypercapnia, suggesting respiratory acidosis, while low levels indicate hypocapnia, indicating respiratory alkalosis. Bicarbonate, HCO3. Bicarbonate is the primary buffer in the body, regulating the metabolic component of acid-base balance. The normal range is 22 to 28 MEq/L. High levels are seen in metabolic alkalosis, while low levels are observed in metabolic acidosis. Oxygen saturation, SaO2. SaO2 measures the percentage of hemoglobin saturated with oxygen in arterial blood. Normal SaO2 is 95% or higher. Lower values indicate hypoxemia, which can result from various respiratory or circulatory disorders. Clinical significance. Arterial blood gas analysis provides valuable diagnostic information and aids in monitoring patients in several clinical scenarios. Respiratory disorders. ABGs help diagnose and evaluate the severity of respiratory conditions such as chronic obstructive pulmonary disease, COPD, asthma, pneumonia, and acute respiratory distress syndrome, ARDS. They provide insights into oxygenation, ventilation, and acid-base status, guiding treatment decisions. Acid-base disorders. Arterial blood gases aid in identifying and classifying acid-base disturbances. Respiratory acidosis and alkalosis are primarily caused by ventilation abnormalities, while metabolic acidosis and alkalosis result from underlying metabolic derangements. Ventilator management. ABGs assist in optimizing mechanical ventilation parameters in critically ill patients. Monitoring PaO2, PaCO2, and pH guides adjustments to ventilator settings, ensuring adequate oxygenation and appropriate elimination of carbon dioxide. Monitoring oxygen therapy. SaO2 measurements help determine the efficacy of oxygen therapy and guide adjustments to oxygen flow rates to maintain adequate oxygenation. Assessment of shock. ABGs aid in evaluating the oxygenation and acid-base status of patients in shock, helping guide resuscitation efforts and management decisions. Conclusion. Arterial blood gas analysis plays a pivotal role in diagnosing and managing a wide range of respiratory and metabolic disorders. By evaluating pH, PaO2, PaCO2, bicarbonate, and oxygen saturation, clinicians can assess acid-base balance, oxygenation, ventilation, and guide treatment strategies accordingly. Understanding the parameters and their clinical significance is essential for healthcare professionals to interpret ABG results accurately and provide optimal patient care.